Will not be heard today on behalf of the author. They pulled the bill. They're going to be doing it at a different day. That's AB 1194. We've got consent items, item number 1, 3, 7, 13, and 16. Upon getting a quorum, we will move those on the consent calendar. We are going to go out of order. The speaker is here. We're going to go ahead and first start off with item number 9, AB 635, Atkins Medical Interpretation Services. Good afternoon and welcome, Madam Speaker.
Thank you very much, Mr. Chairman, for the courtesy. I really appreciate it. And also thank you, members, Mr. Chair. It's my pleasure to present Assembly Bill 635, which will require the Department of Health Care Services to seek federal funding to establish a program that will support medical interpreter services to limited English proficient Medi-Cal beneficiaries. In response to the governor's veto message on a previous bill, this year's bill, AB 635, offers a scaled back and much less prescriptive approach. Today, more than 40% of Californians speak a language other than English at home. As you know, when limited English-speaking individuals attempt to access health care, their language barrier can contribute to inaccurate patient diagnosis, failure to treat ailments appropriately, and/or unnecessary procedures and costs. AB 635 will help California maximize resources by accessing federal dollars to support language assistance to meet the increasing demands of our diverse population. The intent of this bill is to ensure that all Medi-Cal beneficiaries have access to appropriate health care services. Here to testify in support of AB 635 are Elizabeth Landsberg, Western Center on Law and Poverty, and Kimberly Chen, California Pan-Ethnic Health Network.
Thank you. Please proceed.
Kimberly Chen with the California Pan-Ethnic Health Network here in support of AB 635. As you all know, and as Madam Speaker noted, California is one of the most diverse states in the country, and with that is diverse language needs. And in the healthcare setting, whether or not you can appropriately communicate with your healthcare provider has serious consequences. And Madam Speaker noted, these consequences can be very serious: misdiagnoses, drug complications, higher rates of hospitalization. And while existing law requires Medi-Cal managed care plans to provide interpreter services to their LEP patients, the state does not have a comprehensive or coordinated system for the delivery or reimbursement of these services. And as the recent state auditor review of Medi-Cal shows, much more oversight and monitoring is needed to ensure that the language needs of Medi-Cal's LEP patients are being met. So this bill provides an opportunity for the state to offer trained interpreters in a coordinated statewide program for the delivery of language services, enabling the state to better monitor and evaluate the effectiveness of interpreter services in Medi-Cal, thereby improving the quality of healthcare services for these populations. And for these reasons, CPEN is in support and urges your aye vote.
Thank you.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty would echo all of the comments made by Ms. Chen very ably and by Madam Speaker. We know the critical nature of the ability to communicate with a doctor. Your doctor can't treat you adequately, explain your condition, explain treatment options if they can't communicate effectively with you. It doesn't make sense to be leaving federal dollars on the table for these critical services, and we're here in strong support. Thank you.
Beth Capel on behalf of Health Access California, also here in support.
Catherine Scott on behalf of the California Academy of Physician Assistants in support.
Rebecca Gonzalez, National Association of Social Workers, California Chapter in support.
Autumn Ogden with American Cancer Society Cancer Action Network, also in support. Thank you.
Brian Allison on behalf of the American Federation of State, County, and Municipal Employees, also in strong support.
Hi, Christina Boss Hamilton with UDW AFSCME, Local 3930, also in strong support.
Mark LeBeau, Executive Director of California Rural Indian Health Board, in support of the bill.
Thank you. Any opposition to the measure? Questions, comments from any of the members? We don't have a quorum yet. Oh, yeah. Seeing no questions or comments, would you like to close?
Mr. Chairman, I would just respectfully, when there is a quorum, ask for your support and an aye vote. Thank you very much.
Thank you very much. Okay, we're going to move on to item number 2, AB 216, Christina Garcia, product sales to minors, vapor products.
Are these hers? That's my phone. Are those hers? Somebody else's? They are, right? Okay.
Please proceed. Welcome.
Thank you. Good afternoon, Senators. I would like to start by accepting the committee's amendments on Amendment B on page 4, number 10 of the analysis. This amendment would be this amendment would add a contingent enactment to SB 151, which would raise the age to purchase tobacco products from 18 to 21. AB 216 would make it illegal for stores to sell non-nicotine vaping electronic cigarette devices to any minor. Current law only prevents minors from purchasing vaping electronic cigarettes devices with nicotine cartridges already in them. Even though these devices come without nicotine, they are still filtration devices that can be used for smoking cannabis, nicotine, or other herbal substances. E-cigarettes and vape pens often target a younger audience using sweet-flavored compounds that carry names like Skittles, gummy bears, that are appealing to kids. Although they don't have nicotine, these compounds have been shown to contain other harmful chemicals, masked by candy-flavored vapor. Minors under the age of 18 years old right now are free to purchase and use these products. In fact, the number of children using e-cigarettes or vape pens has doubled every year since 2009. AB 216 is an important first step to protect our children who have become prey to vendors with strategically named non-nicotine vapes with fun flavors like Kool-Aid. Unlike candy cigarettes that became socially unacceptable, these products are dangerous for children and act as a gateway to future tobacco use. I respectfully ask for an aye vote.
Thank you. Anyone like to speak in support of the measure?
Good afternoon, Kiara Ross on behalf of the City of San Marcos in support of the bill.
Fred Jones, I serve as legal counsel for the Alcohol Narcotics Education Foundation. While we typically don't take position on legislation, we are an education foundation. This goes to our very mission, and so we strongly support this particular bill. Thank you.
Thank you.
Kathy Hall, representing the 800,000 members of the California State Parent Teachers Association in support of this bill.
Thank you. Anyone else in support? Is there anyone in opposition?
No, in support.
Oh, sorry.
Robert Harris on behalf of the California Society of Addiction Medicine. We think this is a very good bill. We appreciate the amendments that make it the age even more restrictive. And we urge you to support the bill.
Thank you very much. Now, opposition. Oh, support. Okay.
I'm Ralph Merletti from South Sacramento, St. Rose Parish, and I strongly support this bill.
Thank you very much. Anyone else in support? Opposition to the measure? Questions, comments from any of the members? No? We don't have a quorum, but I will be supporting the measure. Would you like to close?
I respectfully ask for an aye vote, and thank you to the committee for working with me on
Thank you.
this.
Appreciate it. Have a good afternoon. I believe I saw Assemblymember Gordon. I did. Item number 4. We still unfortunately don't have a quorum, but please feel free to present. Item number 4, AB 234, food sale. Good afternoon and welcome.
Great. Thank you, Mr. Chair and members. We are in the midst of a growing farm-to-fork movement where residents are seeking to be directly connected to their food. As a result, there's been a dramatic growth in community food production models throughout the past decade. AB 234 would clarify the community food production model. Current code requires that all food, with some exceptions, that is either sold, served, or donated to the public must be from an approved source. Existing approved sources generally include food grown or produced on a commercial farm. Last year, I authored AB 1990, which defined community food producers and gleaners and allows them to engage in direct sales of whole uncut fruits or vegetables or unrefrigerated shell eggs to the public. They can sell these to a permitted restaurant or a cottage food operation if the community food producer complies with a variety of health and safety regulations. AB 234 would make a clarifying change to last year's legislation by authorizing a community food producer or gleaner to sell or provide these products directly to a permitted food facility. This bill was prompted by Governor Brown's signing statement last fall when he signed AB 1990. He said that he had concerns that the bill would inadvertently limit existing paths for producers. He pronounced that this is not my intent. AB 1990 is clearly expansive, not restrictive. So, taking him at his word, what we've done is change one word from last year's bill, and that is to replace the word restaurant with food facility. That covers a more universal entity that sells food products. Recent amendments to AB 234 also address two issues that have been raised by interested parties so far this year. Clarifying that any registration requirements over and above what is established at a statewide minimum will have to be authorized by a local ordinance, giving more local control. And then secondly, also to stipulate that registration under this act would only be required for those who sell through facilities or outlets that are not already permitted. This amendment would further provide that community food producers would not be required to register if their food is donated to a food bank or to gleaners. With that, I would respectfully ask for an aye vote, and I do have a witness.
Thank you very much. Please proceed.
Mr. Chair, members, Justin Malone on behalf of the local environmental health directors, we're the folks that do the food inspections, and we've been working closely with the author for a couple of years on this. Our intent here is to actually promote the access to this healthy food, local foods, and have a modicum, at least a modicum of oversight from the local jurisdiction. So this bill is ideal. We believe it's the perfect pitch to have a reasonable level of oversight, but also to promote this growing industry, and we urge aye vote.
Thank you. Anyone else in support? Is there opposition? Coming up? And I did fail to announce at the beginning, and I apologize, but what we're allowing is 3 individuals to speak in support, 3 individuals in opposition at 2 minutes each, and after that, please come on up for opposition. And after that, then only individuals will be stating their name and their position after that point. But anyway, welcome, and please present.
Is this on? Yeah. Thank you. My name is Susie Grady, and I'm here with Petaluma Bounty, Petaluma People Services Center. And we regretfully are in opposition of this, the language in this bill, because we are a community-based organization that does gleaning in Sonoma County. And we're here to express our concerns about the language of AB 234 as it relates to gleaning activities. I'm not at all, this is my first time coming to this office, and I'm a direct service provider, so please bear with the nerves. Our concerns are that this bill provides an incomplete definition of gleaning activities and gleaned food, and it should also mention that the sole intent of gleaning, as we understand it, is to donate to charitable activities. There's a lack of distinction between food for sale and gleaned food to be donated. The current language will have a negative impact on volunteer gleaning movements with increased burdens brought on by tracking and labeling requirements. The Good Samaritan Food Donation Act, while providing some protection to community gleaning organizations and operations, also specifies that it does not supersede state or local health regulations. Consequently, it's unclear whether gleaners who don't comply with the California law requirement for approved source labeling or otherwise would be protected under the Act. This uncertainty was voiced in the report of the committee consultant. And for this reason, our greatest concern is that the law will have a chilling effect on gleaning activities that support our emergency food systems. We have 3 suggestions that we respectfully submit for consideration. That language is added that distinguishes between for-profit community food producers and not-for-profit gleaners who gather donated food for charitable activities. That the requirements for smaller-sized gleaning groups that provide donated food are limited to ongoing food safety education and a revised signage requirement. That language is added to permit food banks to accept community-sourced donations by gleaners without a source label and provided that the food is not for sale. And lastly, the apparent risk that the Federal Good Samaritan Food Donation Act will be undermined by AB 234 be addressed in subsequent language. The reason why we're here in Sacramento today and not out in the fields gathering produce that would otherwise go to waste is because AB 234 is, if it's passed and implemented as stated, we will be forced to sunset parts of our successful gleaning program, and the end result will be less fresh produce available to low-income seniors and families in our community. We respectfully ask this committee to consider the impact, the health outcomes of these unintended consequences. And I'd like to share concerns forwarded to us from, I'll just take a few members of our community. This is from a gleaning group in Walnut Creek. I operate Loaves and Fishes of Contra Costa, and we feed 500 people a day and rely on fresh fruits and vegetables that are gleaned from backyards and community gardens to provide access to produce to our clients, free of charge. Without such access, the quality of the food we provide would decrease. Canned fruit from the food bank is not an adequate substitute for fresh fruits and vegetables. From Stephen Harper, who runs a pantry in Santa Rosa. I operate a food pantry. We give away free food for those in need every Thursday. We receive food from local gardens and orchards. The quality is excellent, and our clients really want these items. And of course, it's better for them than the canned vegetables and fruits, and it saves our pantry money. This is from a community member in Healdsburg, California. As someone with an elderly mother, I've seen the need for fresh fruits and vegetables at our local food bank. This is mainly supplied by our local gleaner group, Farm to Pantry. Their ability to donate local produce to those who need it will be greatly impacted by enforcement of AB 234. And lastly, a farmer in Gualala, California. We are farmers. The saddest thing to a farmer is to watch their produce go to waste when hungry people need it. We judge a society by how it treats its most vulnerable. If the government can't or won't feed the hungry, at least allow private citizens to help one another. Thank you for your time, and I'm happy to answer any questions.
Thank you, and thank you for being here. Anyone else who would like to speak in opposition? Questions, comments from any of the members? Unfortunately, we still don't have a quorum. Just need one more. And upon establishing that, we'd be more than happy to entertain a motion. So would you like to close?
Yeah, let me close by commenting on the concerns raised by Ms. Grady. We've taken an amendment that we think partially addresses those concerns. We also believe that the Federal Good Samaritan Food Donation Act also provides a level of protection. But I want to assure this committee that we will meet with Ms. Grady, further review her concerns, and see if we can further refine this legislation. It is not our intent in any way, shape, or form to provide any diminishment to the ability for folks to donate food.
Why don't we establish a quorum and see how we can act on your bill? Call the members, please.
Hernandez?
Here.
Hernandez here. Nguyen? Hall? Mitchell? Monning? Monning here. Nielsen? Nielsen here. Pan? Here. Pan here. Roth? Wolk? Here. Wolk here.
Quorum has been established. Is there a motion? Moved by Senator Wolk, and please proceed.
Yeah, we're just at this point respectfully ask for an aye vote.
Thank you. We have item number 4, AB 234, moved by Senator Wolk. It's due pass to appropriations. Call the members, please.
Hernandez?
Aye.
Hernandez, aye. Nguyen? Hall? Mitchell? Monning? Monning, aye. Nielsen? Nielsen, aye. Pan? Pan, aye. Roth? Wolk? Wolk, aye.
Currently has 5, enough to get out. We're going to place that bill on call. We still have some members that are absent, and thank you.
Thank you.
Okay, I think I saw Assemblymember Brown, is that correct? Just want to make sure nobody else was here. Item number 8, AB 614, Healthcare Standards of Practice. Good afternoon, Assembly Member.
Good afternoon, Dr. Hernandez. Good afternoon, Chair and members of the Senate. AB 16, I'm sorry. We're ready to start? I think I have a...
We're ready to start. Let's...
Okay. AB 614 will streamline the process used to update healthcare standards of practice in health facilities and clinics. The bill will also ensure the state's definition of eating disorder is defined by the Diagnostic and Statistical Manual of Mental Disorders as published by the American Psychiatric Association. Title II of the California Code of Regulation references the healthcare standards of practice that are adopted by nationally recognized professional organizations and used throughout our state's healthcare facilities. While the standards of care have been updated over the years, the regulations containing these standards have not, because the rulemaking process can take years to complete. AB 614 would address this issue by creating a streamlined process that requires a 45-day notification period, a 30-day public comment period, and a hearing upon the request of a member of the public. In addition to these provisions, which are consistent with current Administrative Procedures Act rulemaking process, the bill requires the California Department of Public Health to use the full APA process if there is opposition to the proposed standard update. And I don't see my witness in the audience.
Okay, anyone else like to speak in support of the measure? Any opposition? Any questions from the members? Question, Senator Pan, or move the bill?
Well, thank you, Member Brown. I appreciate, I think, what you're trying to do here. I just want to clarify, because one of the issues is that I know what you're trying to do is to be sure that we have the most up-to-date information for our regulatory process through the Department of Public Health. And certainly, there's evolution in our knowledge about health and guidelines and so forth, and it moves quickly. At the same time, I just want to be cautious and careful about, because these are regulations, and as regulations, we as a state need to be responsible for them, and that we're not creating regulations by fiat through some other organization, even esteemed ones, right? And so, and I know you mentioned in your testimony, I just want to clarify. So you have a regulation, refers to guidelines, let's say about diabetes from the Diabetes Association, clearly an eminent group, very knowledgeable about diabetes. But they develop a recommendation which may be problematic, right, for the state, or someone thinks is problematic. In that case, what's the mechanism by which a group that may find something problematic for whatever reason, what remedies do they have to be able to bring that up and to have a hearing about that, to ensure that we don't have, that we don't have another agency, essentially an outside body, essentially creating regs for the state of California outside of the regulatory agency and outside the regulatory process, because regulations obviously have force of law behind them.
Okay. What I would like to say to that, and my witness has just come, but all the member of the public has to do, all the member of any place, all they have to do is request a public hearing. So it's not an onerous kind of procedure, it's just requested.
Okay, so simply, just to clarify, so there's a change in the ADA, some guideline that an outside group that's referred to, someone says, I'm concerned about, I don't like that, they just have to send a letter to the Department of Public Health, and that will trigger an entire administrative hearing on that change. Okay.
It's a streamlined process. You know, we're just doing too many, the things that we do in Sacramento, as I see them, is that there's nothing really streamlined. It takes so long. And for the Department of Public Health is having all kinds of issues trying to address things, mainly because of all the regulatory issues that they have to face. But I have a witness here who will.
And can I just maybe follow up with one brief question after that? Is there any sort of notification process that there's been a change that occurred because somebody referred to, because, I mean, if you don't know that something's happened, you're not going to be able to look for it. So I think those are the two pieces. So one is that, okay, you can get it by simply sending a letter, but is there some sort of notification process that happens that says, hey, we had it referred, the guideline we referred to actually changed, and so that people are actually aware that there is a change?
I'll let my sponsor talk about that.
One of the requirements of the proposal would mandate the department to post on its website. In addition, will require that the Office of Administrative Law send the notice out to the stakeholders that we have on our mailing list for whatever facility category the reg would apply to. So there is notice. It's the same process as the regular rulemaking process.
Thank you. Any other questions from any of the members? I believe we have a motion by Senator Wolk, and would you like to just briefly make a couple statements?
Sure, and I apologize for my lateness. There was some confusion. The proposal creates an efficiency for the department, as the Assembly member already stated, by allowing it to use a streamlined rulemaking process to update a regulatory requirement that contains an outdated national standard of a specified national organization with the current standard of that same organization. And I can give you a couple of examples. For example, Section 70563, which pertains to hospitals of the California Code of Regulation, addresses the service space for physical therapy. It references the 1971 edition of the American National Standards Institute. That regulation needs to be updated and replaced with the 2009 edition of the American National Standards. And that's just a simplistic example of what this proposal would allow us to do.
Thank you. We have a motion. So I'd like to commend the author. As a matter of fact, when I was briefed on the issue, I raised the exact same questions immediately that the senator had asked. And if you'll notice on the analysis on the first page, section 2 under the bill, it has all the criteria of what happens if in an individual, any individual, just one individual has a concern, then it has to go through the public process, the regulatory process, et cetera. But there are certain departments, and I agree with you, Assembly Member, that just aren't doing their work and getting the regulations out, and it's very onerous. So obviously in support of the bill, we do have a motion by Senator Wolf. Item number 8, AB 614 Brown, do pass to appropriations. I forgot to ask, would you like to close?
I ask for your aye vote.
Thank you. And would you call the members, please?
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Monning, aye. Nielsen. Pan. Aye. Pan, aye. Roth. Wolk. Aye. Wolk, aye. Nielsen, aye.
Currently has 5. That's enough to get out. We'll put the bill on call. We have some absent members. Let's try to move back to item number 2. Is there a motion? Moved by Senator Wolk. Item number 2, AB 216 Garcia, do pass as amended to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Hall. Mitchell. Monning. Monning, aye. Nielsen. Nielsen, aye. Pan. Pan, aye. Roth. Wolk. Wolk, aye.
Currently has 5. We're going to place that bill on call. Item number 9, AB 635